Namaste. Welcome all to today's live session with the most sought after orthopedic surgeon who holds a specialty in shoulder, Dr. Pavan Chebbi. A lot of us have a lot of problems with our shoulder, and maybe because of the current lifestyle that we are leading, we don't really pay attention to our bone health. Let us talk to Dr. Pavan today and see what are the different problems that are faced with respect to shoulder, and let us listen to what he has to say on this. Over to you, doctor.
Thank you. Hi, I'm Dr. Pavan Chebbi. I'm a consultant orthopedic here at Apollo Spectra Hospital. I specialize in sports medicine, sports injuries, joint replacement, and trauma surgery and deformity correction. I have a special interest in shoulder surgeries. So today we'll talk more about shoulder surgeries per se, instead of talking about the shoulder injuries or the common shoulder problems that we have heard a lot about it, But then let me talk specifically about the surgical part of the shoulder. So if I have to talk about a brief about shoulder conditions, I can broadly classify them into the ones which happen at a younger age and the ones that happen at an older age. So the common conditions which happen in the young age is more related to the stability of the shoulder joint, where there is obvious dislocation being the most common, in which there is a recurrent shoulder dislocation where the shoulder pops out mostly in the front, 95% of the time it's in the front, or if there is some issue with is sports related or related to something to do in the plane of movement of the shoulder. So there are conditions in which apparently the shoulder is all right, but then if the shoulder is exerted in one particular movement, that is going behind, going up, and twisting, you will have significant amount of pain and loss of movement. Also, of course, the obvious instability, where person who has had one or multiple shoulder dislocations tends to have an unstable shoulder, which is very unpredictable, and if he is not conscious about his shoulder movement, it gets to pop out or dislocate, leading to an unstable shoulder, which restricts in, of course, the day-to-day activities and also the sporting activities. There are other conditions called as the slap tear, which is very common and commonly missed, goes unnoticed for a long time, which can lead to bigger problems later in the shoulder. So these slap tears are small tears on the top, which usually happen due to small subluxations, that is partial dislocation of the shoulder on the top part of the shoulder joint at the labrum. Here what happens is more related to throwing, when a person tries to throw or tries to reach out something from behind, tries to reach out from top, he or she will have restriction and he or she will have a significant amount of pain. Of course, there is to a lesser extent, usually in high velocity injuries and high velocity sporting traumas, you will have the rotator cuff tears and of course avulsion fractures and fractures. Of course, I don't want to discuss about fractures because it's completely different ball game, but then I'm talking more about the soft tissue conditions around the shoulder today. And then coming to the older age group, where the common condition, which is what we hear, is about frozen shoulder, but frozen shoulder actually encompasses a lot of other things underneath it. So it's commonly termed as frozen shoulder, which is actually a misnomer, because frozen shoulder itself is a different condition, which is a slowly developing condition, more common in metabolic conditions, metabolic diseases like diabetes, etc. But then a lot of other conditions like impingement syndrome, tendinopathies, you have rotator cuff tears, degenerative or be it traumatic after an injury at an older individual, 55 plus. They tend to restrict the shoulder movement, or they usually don't have so much of a use for the shoulder because their activity is less, their demand is less. They tend to restrict the shoulder movement, which causes the shoulder to go into stiffness, ultimately leading to a stiff shoulder, which is again misunderstood as a frozen shoulder. So here in general you have the rotator cuff tears, which are more common. In general, rotator cuff tears, the rotator cuff, that is the four tendons which help in the rotation of the shoulder, do have some amount of tendinitis or do have some amount of tear, but then when it becomes a pathology or it becomes a condition where it hurts the person or causes trouble to the person, when that particular shoulder is not functional, the particular shoulder starts to hurt the person, especially during the night. So if there is a significant amount of night pain, restricted activities, frequently the person complains of loss of movement which is progressing and stiffness, then we have to suspect something to do with the rotator cuff tendons. So over here, when you see a rotator cuff tear, when it is ignored or when it progresses at a later stage, or maybe just a frozen shoulder or adhesive capsulitis progresses at a later stage, it leads to arthritis of the shoulder. So an arthritic shoulder, just like arthritis of your knee and hips, an arthritic shoulder does get stiff, does cause a lot of trouble in day-to-day activities, and is a painful condition. In the past, there was no real answer for this because these patients have a rotator cuff tear where we cannot do a shoulder replacement. So it's been a decade that we have come up with a revolutionary surgery called as a reverse shoulder replacement, a reverse shoulder arthroplasty, where the cup becomes the ball and ball becomes the cup. This is an extremely successful surgery in which when we select the patient population correctly, when we do the surgery, it is remarkable. It gets people who have never used their shoulder for decades together to get back their shoulder movement, and they can have completely pain-free movement, and they can go about doing their light sporting activities, underarm sporting activities as well. So about shoulder surgeries, coming to the younger age group where it is more related to instability, the surgeries for this are all arthroscopic, that is, they are all keyhole surgeries. We use special small tiny instruments to make sure that the shoulder is damaged in a very minimal way surgically so that the recovery is faster. These surgeries usually which are related to stability, that is labrum repair, Bankhart's repair, Hill-Sachs repair, slap tear repairs, acromioplasties for impingement syndrome, for rim rent tears of the supraspinatus in younger patients, for pasta lesions in younger patients, so younger and middle-aged patients. These surgeries are done in keyhole, that is as arthroscopy, usually with small pricks which are less than an inch, about minimum 2 pricks or maximum about 5 pricks and or holes. These are precision surgeries, so we try to reconstruct the actual anatomy of the shoulder, how it was in the before the injury. Here what I have seen is the guarantee to success is very good, the return to sport is very good, and also patient satisfaction is excellent. Of course, selection of patient is important. Of course, when the person comes for the surgery is important, and how well, after all what we have done, how well the person performs the post-operative physiotherapy is important. So when they do all this and when everything is right, it is an extremely satisfying and successful surgery. So here what happens is, over here in Apollo Spectra in Bangalore, we do shoulder surgeries as a daycare basis, irrespective of whether you have insurance or you don't have insurance. So they are all done as daycare procedures where the previous day you do your insurance formalities or blood tests or pre-anesthetic checkups, etc. Go back home, come the next day at the time of surgery, get the procedure done, and within maybe 3-4 hours, max about 7 hours, once you are a little more comfortable, once the pain is a little reduced and your shoulder is immobilized, you can walk back home. Most of my patients do that. Of course, there are some odd patients who prefer to stay back. There's no problem with that, but then most of them, they tend to go back. Return to work, especially with shoulder surgery, is amazingly quick in a younger individual. I have seen a few of my patients who have, after a couple of hours of the procedure, have gone back to sending their emails and doing their work from home or work from hospital, whatever it is, as a routine. Now, also we have to understand that post-operative physiotherapy is a very important part, and usually people who have these injuries are pretty much into sports, so they are pretty much aware of exercises and they are pretty much consistent in doing this physiotherapy. But then it is important, it's an important point to know that physiotherapy is an important part of any sport related surgeries. Also, one more thing I had to mention is somewhere in the middle age, we have something called as an impingement syndrome, which leads to early degeneration of shoulder. Those also can be done as a daycare surgery. These are very minor surgeries which hardly take about 15 minutes, like for example subacromial decompression, etc., where the patient can be extremely comfortable after the surgeries and they can go back home without any problem. Coming to the surgeries which are done in an older individual, so here with rotator cuff tears, etc., these surgeries I have seen people being extremely comfortable even in a person who is 55, 60, 65, up to 70 years, as we can consider these as daycare surgeries, provided they don't have any other metabolic condition or any other comorbidities. The patient, he or she can go back home the same day. Of course, they can also start doing their day-to-day activities, which are underarm activities, which don't require much of shoulder movement, almost the next day without any trouble. Pain can never be a factor because we give ample amount of pain relief, we give ample amount of post-operative analgesia. And also, usually in the older individuals with rotator cuff injuries, where we do the rotator cuff repair and related repairs, recovery is a little slower. It's about 3 weeks plus because it's something because of a degeneration that has happened. So it will take some time for the joint to regenerate. But then, provided or coupled with good physiotherapy, they are back to normal activities within 6 weeks. Coming to the shoulder replacement surgery, or in patients who requires a reverse shoulder replacement. So this is usually required in patients who are older, that is 70 years plus, who have pretty much a loss of the rotator cuff function, pretty much destroyed shoulder joint, and they should be pretty much a good amount of bone stock. So in them, a reverse shoulder replacement is very beneficial. And here what happens is we convert the cup into a ball and the head in this area into a cup. The mechanics is altered, but then the muscle, the external dynamic muscles of the shoulder, which gives stability to the shoulder, start to act in a way where the patient can start with early recovery, early mobilization can be started as early as possible. Here also, after about 2 or 3 days of hospitalization, the person usually gets back into underarm activities and pain-free movement at a pretty much decent rate, provided how much amount of physical strength he or she has owing to their old age. So this was about just a brief about shoulder surgeries. So shoulder surgeries many a times are ignored, many a times have been delayed, because once a person has got a shoulder injury, he finds the use of his elbow or wrist or restricts that particular movement. But then what happens sometimes when a person is really enthusiastic to use his shoulder, maybe a sportsman, maybe a recreational sportsman, maybe an active person, maybe something which a job requires for. So if they choose to get their surgery done earlier, the chance of recovery to near normalcy or normalcy, complete normalcy, is good to excellent. And also in persons who have got a proper sporting career, a chance of return back to sport is pretty much excellent without any restrictions of play. And in an older individual, irrespective of the date of injury, irrespective of the years of pathology a person has, irrespective of whether the person is diabetic or has metabolic condition, there is a solution. There are different types of surgeries which can be done as an arthroscopy. Most of them are arthroscopic. You have mini open surgeries, and of course you have your shoulder replacement and the reverse shoulder replacement surgeries. So this is about the shoulder surgeries and the common understanding and the common problems which people encounter and how to solve them. So I think that concludes my talk on the shoulder surgeries in general.
Thank you very much, sir, for this detailed description. Here are a few questions that laymen would like to ask to understand better on whatever you said. You said that shoulder surgery can be done as a daycare surgery, but after discharge, are there any complications that one can expect at home? If you could shed some light on the same.
Yes, yes. Um, yes, see, most of the shoulder surgeries, if they are mini open or arthroscopic, can be discharged on the same day. We give a general anesthesia, but also we give a block to that particular area where the pain relief is pretty much good. Usually during these arthroscopic surgeries, we inflate the joint with some saline fluid. So this swells up the shoulder. Only till the time that swelling is there, the pain is there. Once the swelling goes away, which is usually in about 8 hours, 12 hours, max to max 24 hours, the pain pretty much disappears. Because these are very small pricks which we do, less than an inch. Usually in 2 holes we complete a slap repair, for example. And also the recovery is pretty quick. So if they have oral painkillers, they are pretty much good with pain relief. Sometimes if there is a sensitive patient who has got a low pain tolerance, we keep them for 1 day overnight. We give them IV medications for a little longer, but 24 hours is max, not more than that. The pain should continue to be there.
Thank you. For how long should one rest his or her shoulder for dislocated shoulder surgery?
Yeah. Yes, so depends upon the type of or the grade of tear. So sometimes if there is a larger tear of the shoulder, the labrum, for example, a person has got a shoulder dislocation multiple times, which has led to a larger tear, which requires more amount of stitches. The recovery also can be a little longer. But usually for smaller tears of recurrent shoulder dislocations, slap tears, etc., couple of weeks should be enough. Max to max, I would say about 4 weeks, that is about a month, that a person can restrict the shoulder movement. That is only the overhead I'm talking about. Lower down in this plane, you can do most of the movement pretty much after the 3rd day. But then overhead movements and movements which require you to take your shoulder back will take about 4 weeks or 6 weeks, whatever the severity of the tear is. And return to sport, I would say about 3 to 6 months, throwing and bowling, etc.
Thank you. You were also talking about the shoulder replacement surgery, which is done with so many alternated mechanics. So how successful is that shoulder replacement surgery?
Yeah, see, about the reverse shoulder replacement, I think the question is about reverse shoulder replacement. So reverse shoulder replacement, according to a recent study or recent studies, success rate of or excellent satisfaction of the patient rate of 85 to 90% is excellent results. So usually these are patients who are 70 plus, who have very low demand. Max to max they play is golf, not more than that. They are able to do overhead activities. They are able to do activities which require you to take the shoulder out so much. These surgeries, the patient selection is important. How well the person is going to do the physiotherapy, that is important. How much of a shoulder is destroyed, how much of a bone stock is available is also important. But all in all, no matter what the shoulder condition, the success of this, I can say in my hands, I would say about 90% excellent results I have got till now. And it's not as major as a knee replacement, because it doesn't require a prolonged rest for the shoulder, just like a knee replacement where we start making them to walk immediately, or rather in about a few days. Similarly, after shoulder replacement, we can start doing the movement in a few days' time, and pretty much the success rate is good for a reverse shoulder replacement.
Thank you very much, Dr. Pavan, for throwing light on different aspects of shoulder surgery and how we can overcome the complications and how easy it is for us to get back into normalcy. Thank you very much. If there is any question or if there is any consultation, or if you would like to consult the doctor, I would repeat that doctor consults at Apollo Spectra, Bangalore, and you can take appointments and meet the doctor in person. Thank you.
Thank you.